Well, it's wonderful to be here, and so thank you so much to Anna for the invitation. It's been such a treat, and particularly to come to Philadelphia, which has been a fabulous city to look at from the sorts of issues that we've been talking about here about walkable communities. I got a tour of the city from the Professor of Landscape Architecture at Penn University on Monday, and we went around on bikes and had a look, and it was really fabulous to see the city in action. So what I'm going to talk about is using local evidence really for advocacy, and I want to base it on the experiences that we've had in Australia. Just to give you some context about Australia and sort of some of the issues that we're facing. We like to compete with the US. We've got about more than 50% of people who are inactive, so we're really up there in the stakes, so we're very pleased about that. You know, we're a very competitive country, we like to win gold, so we're chasing you. 29% of people are obese now. We're gaining, we're doing well. And 85% of our deaths are due to NCDs. So we've got a lot of preventable death that we could do something about if we change the way we did things. The other contextual aspect I think was really important here to consider is just how the country is changing. We're a population pretty small, same sort of size as Canada really, around, or a little bit smaller than Canada, 23 million people in 2013. But by 2050, it's estimated that our population is going to grow up to 42 million. Now, this is sort of really alarming our policymakers. It's making us to think about how we're going to house people. Are we going to continue to spread people on the fringe, or are we going to stack people into high density housing? How are we going to mobilise people? Are we going to continue to have people drive cars? Or are we going to create better public transport? So there's a lot of discussion going on. Now, from the public health perspective, you know, we're obviously trying to push the walking, cycling, public transport agenda. And of course, you know that there's a growing amount of evidence now, lots of evidence, all different sorts of reports coming out throughout the world about why we need to create more walkable communities. So there's no shortage of evidence. And in Australia, this latest, the document there is the Heart Foundation in Australia has really got onto this case. It has an association with the Planning Institute of Australia and the Australian Local Government Association, and it's put out guidelines around how to create healthy spaces and places. So there's a lot of pushing to try and change the agenda. We have now healthy built environment reports coming out which go beyond, as we heard from Howie, going beyond just thinking about physical activity to include issues of mental health, food environment, but a broader agenda around how healthy built environments can influence health. So there's a lot of discussion about, you know, what we should be doing. And of course, we hear all the time that what we should be doing is less of this type of development we see so much of on the urban fringe, the big box shopping centres, the curvilinear streets, the streets that have no human scale, big wide streets, no surveillance. And what we really want is more of this, conviviality, access to shops and services, good cycling and walking infrastructure, medium density housing, and also public transport, so critical to make all this work. So the regional plan is as important as the local urban design. Now, would it make a difference? So it's nice seeing some work, Jana Hirsch's work come out. What happens when people move into a more walkable community, a 10-point increase in walk score. And what she found was that we see a significant increase in walking for transport, no change in leisure time activity, but a slight decrease in BMI. So all promising directions with some longitudinal data. We see the similar thing actually with work that we've done. We looked at people relocating to new neighbourhoods. It was a study of people who were relocating into new neighbourhoods after they built houses, and we looked at what happens when they relocate to new neighbourhoods and they gain utilitarian sorts of destinations. The local shop, the cafe, post box, newsagent, bus stops, these sorts of little types of destinations. And we looked at, well, what happens in terms of their activity, and we found that if they relocated into these neighbourhoods and did have these destinations, for each type of destination that was there, they gained about 6 minutes of walking for transport. And actually the recreational results were even more impressive. About 17 minutes of extra walking for recreation for each recreational destination found. So there is some growing amounts of evidence that, you know, if you walk, you move in, we created these places, people relocated, even adjusting for self-selection, which we did in this particular case, that people are more likely to walk more, that it's going to be beneficial. The interesting thing is that when we start to map this and we do the sort of GIS maps of it, we start to see that walkability is spatially patterned. And here we have the map of Melbourne, which we put out when I first came to Melbourne. We started looking at this, and you see this sort of social patterning. You see that this is inner Melbourne, and Melbourne is, a very attractive place to live. And you can see that if you live in inner Melbourne, it's highly walkable. Here's the map. So down here, anything green is not too bad. Anything from yellow on is not very walkable. So even though in inner Melbourne it's looking pretty good, once you start to go out to the urban fringe, or if you're not on a train line, some of these are train lines, and you can see that there is a bit of walkability along here, and that's reflecting the train line. But once you start to move out beyond the train line, you start to see that it's not so walkable. There's good reason that people won't be doing much walking in those areas. The other thing we find is that we have a spatial patterning of transport. This is not our own work, this is work done by Jan Schurer. And he looked at not only access to bus stops or to public transport stops, but he also looked at the quality of the service. In this case, anything yellow through to green is looking pretty good. So again, in inner Melbourne, but once you start to go out, you've got from orange through to red, you start to get pretty mediocre, if not poor, services. So public transport is also spatially patterned. Now, if we look at the bicycle network, this is a terrible map actually, but nevertheless it tells a story, and people don't like seeing this in Melbourne. It's pretty horrible. Red is not good, as you can sort of see. This is anything from yellow, anything red is not good. But in inner Melbourne, again, we see this really nice spatial patterning of good access to the principal bicycle network, so the opportunities to cycle, not the case when you get further out. Now, so what? Is that important? Well, what we see, of course, is we see the spatial patterning of disease. This is Heart Foundation data. What we've got here is anything that's dark red is higher levels of heart attacks, heart attack admissions, hospital admissions. And then the Diabetes Associations have also started to map its diabetes results. So here's very high rates of diabetes, and so you can see out in the fringe, you start to see these patterns. What you see in Melbourne, these are the low, very low patterns, and you've got sort of high levels here. So what we're seeing is that, again, this sort of social patterning of disease, social patterning of walkability, poor access, spatially patterned. So the question is that how can we use local evidence for advocacy, to change this? This is a sort of massive change that has to take place to improve the situation. Now, I want to introduce you to a colleague of mine. His name is Ian Butterworth. He's a Director of Public Health for a regional, the northwest region of Melbourne, which is rapidly growing. Melbourne's growing pretty quickly anyway, but in the northwest it's growing about 8% a year, which is really massive. One area, there's 70 babies a week being born. If you were the mayor of that place, you can just imagine how scary that is. That's sort of like 3 classrooms of children needing to school. So these are all new growth areas where there's no infrastructure. So when I first went to Melbourne, which was in 2011, he got me and said, "You've got to work with us. We have a crisis here. We need your help." So I asked him the question. Here, I hope you can speak to us. What sort of evidence do you need to create a more supportive environment?
We need conclusive evidence that shows the relationship between good urban planning and making it easy for people to experience exercise as part of their everyday lives. Not just exercise, but also access to good places, access to healthy food, access to great public transport that's reliable, affordable, frequent, integrated with other forms of transport. We need to make sure that people have got good access to local parks, fresh food outlets, entertainment, leisure, friends and family, or at least transportation options to get there. That information needs to be taken up not only by health people, but in particular by developers and by people that manage urban planning portfolios. Ultimately, we want to influence the policy and legislative environment that makes it imperative for any urban development proposal to show that it links into best practice and the evidence base to support that.
So, big agenda, and that was what he was asking me to to look at when I first came to Melbourne. Actually, this slide hasn't worked perfectly, but for me, what that said is I have to sort of shape my research to be able to speak to all these other agendas, which not necessarily health agendas. Now, what's underneath this, which you can't see, unfortunately I didn't do the build correctly, but it's a slide showing that Melbourne has been ranked as the most livable city in the world for the 5th time running. So Melbourne loves the fact that it's said to be very livable. We compete with Vancouver as a livable city, and it loves this idea. So what I did was we tied our research to the notion of livability, because we know that that resonates with policymakers. I must say that they're really quite scared that I'm going to show that Melbourne's not the most livable place in the world. So they're really worried about this now. And the whole idea of livability is really, very popular in the discourse, the policy discourse. This is our national urban policy for a productive, sustainable future, livable future, which is the federal department. In Western Australia, we have the Livable Neighbourhood Guidelines, which is subdivision design guidelines, which are designed to create better urban design. So again there. And we helped to write Plan Melbourne through my work with Ian Butterworth. We got to write Plan Melbourne, which is the Melbourne Metropolitan Planning Strategy. We have livable communities and neighbourhoods. We know that that resonates with them. And what we've included in there is the idea that we create healthy, active neighbourhoods and the idea of the 20-minute neighbourhood, that people can actually get to services within 20 minutes. But the question that puzzled me when we know everyone's talking about livability and it's a good thing, it has resonance with policymakers, we wanted to know, well, what is actually livability? What do they mean by livability? No one really, and how do you measure it? So what we've been doing is focusing our attention on how do you measure livability. We did a literature review. It's available on the web if anyone's interested, of what are the key indicators of Melbourne as a livable neighbourhood, and what would be the key indicators. What does the literature tell us about how people are defining livability? We've published that if you're interested in social science and medicine. And we've also done a paper, Mel Lowe, one of my PhD students, has done a paper targeting the planning groups as well. So we've got it out there. And what we did was we defined livability, taking together everything that people are saying about a livable community. It's safe, it's socially conclusive, it's cohesive and inclusive, it's environmentally sustainable, because if you actually look at the literature, you'll find that most livable cities in the world are not very sustainable, so we need to have a look there. We have affordable and diverse housing linked via public transport, walking and cycling, to employment, education, public open space, and all the services that you require for good living. So what we've been able to do is use a social determinants of health lens to think about livability, and now our job is to see how can we use that for our advocacy purposes? How can we measure it, and then how can we feed it back through mapping and other sort of sources? So this is how we think that livability might impact health. Here are all the policy areas that cover aspects of livability. We think that that's linked to all the intermediary outcomes, levels of walking and cycling, perceptions of crimes, crime rates, educational outcomes. And then that creates a livable community, which are the final outcomes, but ultimately that affects population health. So we're starting to conceptualise this to say, well, we think that livability is important, we think we need to be working on it. So what we've done is we've set up a livability study, which is about creating and validating spatial indicators of livability, defined through our lens, our social determinants of health lens. So they're going to be associated with health and wellbeing. But what we're doing is actually looking at, in all the policy areas, what does the policy say about each of these areas? How well is the policy being implemented? And even if the policy was implemented, are the policies likely to predict health and wellbeing? So we'll be able to feed back to them if their policies are actually meeting the objective of promoting health, and if they're not, what can we do? Okay, we've got other indicators for each of the policy areas that might be a better policy. So we're actually testing out their policies and testing out alternative variables that we come from the literature to see whether or not we can actually improve the policies that are being implemented. I should just acknowledge Hannah Badland, who's leading this work for us in our team. Now, the domains of livability that we're looking at is access to employment, food, affordable housing, public open space, transport, walkability, and social infrastructure. And the process that we're going through is we're conceptualising for each of these domains how they might be related to health and wellbeing. We're identifying all the spatial measures by doing policy analysis for each of those areas to say, well, how has it been, what's the requirements in terms of policy to achieve each of those domains? And then we're looking for the spatial data. We're validating the measures against health and wellbeing outcomes. We're building the indicators, and then we want to create a liveability index. Now, if you're interested in looking at that, you can have a look at the, we've got some work on the conceptual work that we've been doing, How Liveable is Melbourne, on our website at the Mackackie Centre. Now, we've also done a report on how walkable is Melbourne. We've put that out into the public domain, and that's got a lot of interest. So that photograph took a very long time to take. The woman was lying on the ground as she took it, but the photographs, we're trying to get the out into the media to talk about how livable and walkable is Melbourne. So how are we going to disseminate this sort of information? We're looking at, and to support local advocacy, one of the ways we're doing that is through Community Indicators Victoria. This is an indicator program that's been funded by Vic Health, which is a big funding agency in Victoria. It's working with our team, so what we're doing is our team's providing them with the data. What Community Indicators Victoria does is train local government to use data, and we use that we go out to local communities and get them they have to do municipal health planning, and we help them use data to inform their municipal health plans, and we can distribute all the data on each local government area. This is our walkability data. We can put that onto our website, and they can use that for their municipal health planning. The other thing that we've been doing is providing consultancy services to local government, and so this is one for Burundara. We're using our indicators and we're assessing, providing them with particular feedback about what they could be doing to improve the livability of their areas. So we provide them with a map. This is about distance to the closest public open space across Burundara, and we give them very detailed information about their own local government area. This is one about deciles of transport walkability. So that's the walkability map in very great detail for them. So it's a way of providing them with data to help them to achieve better outcomes for their communities. Now, what have we learnt about how best to work with, to use local evidence that will resonate with our policymakers? This has been published actually in a paper that we've put out in the Journal of Public Health Policy. And what we've learnt is that what's really incredibly important for us to have an impact is to understand the policy environment in which we're trying to influence change. So most of the people that we're trying to influence are outside the health sector, and we need to understand the policy world that they're working in. We've also realised that what we have to do is build relationships with the policymakers and, if possible, establish joint research agendas. And though I've said that people are a bit afraid about what we might find in terms of our liveability study, because they don't want to know that Melbourne's not livable, the work is being done in collaboration with the Department of Planning, the Metropolitan Planning Authority, the Local Government Association. So it is done with them. It is work that's been done with our policymakers. So it's not just been done in the academy. We also have realised that what we need to be doing if we want to make a difference is undertake policy relevant research questions and to understand what the policy implications are. In many ways it's hard to do that unless we're working with policymakers, because they're the ones that understand the policy environment so much better than we do. It means the thing I think is really incredibly important is not just to do this work with policymakers, but have a third arm, and that's to actually do the work in partnership with knowledge brokers, advocates and lobbyists, because they can do a lot of the advocacy to actually get the local data taken up by the departments. It does require a lot of advocacy to make policy change, and so we can't do that by ourselves. It's really important to have the advocates working with us. I thought I'd just finish with a bit of an epilogue, what I called an encouraging epilogue. The work that we started on livability started in 2011, and last week as I was preparing to come to the US, I got an email which was about the release of the Victorian Public Health and Wellbeing Plan 2015 and 2019. What I was really pleased about is in their policy is that they have a whole focus in this policy, which is very different to their previous policy, on place-based approaches, that they realise that to create health and well-being requires more than just focusing on individuals. So there's a whole focus on place-based approaches. They make the point that health and well-being is everyone's responsibility, not just the health sector's responsibility. And I guess what really thrilled me was their focus on livability. So here they have talking about the livable neighbourhoods, and they're actually using our definition of livability in their own policy, which is really important. Now, the reason why that's so important, in our context at least, is that in Victoria, the Public Health and Wellbeing Act of 2008 requires local government to do a couple of things. First of all, it must include data about health status and health determinants in their municipal districts. So when they do their municipal planning every 4 years, they must examine data, and they must also identify goals and strategies based on available evidence. And so what that means for our indicators of livability now, we're going to put those onto CIV. They're going to directly speak to the policy that the government has set up, their health and wellbeing policy, and we will be able to hopefully have that data influence local government to produce better outcomes at the local level. That wouldn't have happened if it hadn't been for Ian Butterworth, who you got introduced to in our talk, who talked about what sort of data he needed, and the fact that we've tied our research agenda directly to what he needs to do his job means that we've actually been able to align the policy now with our evidence, which we're just going to be able to have come out next year in time for the planning cycle for the municipal health plans, and that's come from this very strong relationship with our policymakers. So I'd like to just acknowledge all the team who have been helping to contribute to this work, and also Hannah Badland, who's been leading our health and wellbeing and livability work. So thank you.
So why don't we take a question or two for Billy? Yes, right here, please.
Hi, I'm Ana Martinez Donate. I'm with Drexel University School of Public Health, brand new here. I was just thinking about what you were talking about, what makes a neighborhood or a city a livable one. And as somebody who has just moved in the city of Philadelphia, and obviously I have been looking for housing, I was just thinking that once again, I think the market, the business sector is way ahead of us, public health people, in a way, because they seem to get it right away. When you look for housing, they're telling you about all of these things that we are trying to figure out, do they make a neighborhood livable? They seem to know it. They tell you, 3 minutes from Whole Foods, 2 parks within a block or 2, next to the best public school in town, safe, walkable, high walkable index, blah, 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 which makes for a very livable place. So I'm thinking, yes, data is good. We need to get all of those data. But I think in a way, we kind of already know what makes something more or less livable. And maybe what we need is a little more of knowledge on how to translate that into action. So I really appreciated your talk, because I think you gave us a lot of good insights about how to transform those data into real actions. Thank you.
I think what really worries me is that I think the development industry, or the real estate industry, does know that. It's not, we've got the spatial distribution of what makes a place livable. And when I talk to people like Larry Frank, who's a transport planner, he says, well, if we make places walkable and livable, that's going to gentrify it, and that means that prices will go up. But if it was ubiquitous, if we could actually redistribute livability and walkability, it wouldn't necessarily. Everyone should have the basics. I mean, in Philadelphia, it's really quite interesting because it's a very walkable place. In Melbourne, you can see that it's very walkable inner Melbourne, but it's certainly not walkable once you get out. And my view is that we wouldn't build a community without water and sanitation. We have to actually try to build these other things so that people who are disadvantaged also get to have the joy of of living in a livable place and a walkable place. And I think if we were able to redistribute that, it wouldn't be put prices up, because it would just be that everyone would have that. It wouldn't be that you might have a better place with more shops and services. I don't mind that, but I think everyone should have access to the basics.
We'll take one more if there is a question.
At the back there.
Yeah.
Andrew Issa, Dornsife Center at Drexel University. I was wondering, how do you ensure livability without losing city or neighborhood identity? It seems like a lot of these cities are following the same cookie cutter planning process. What are your thoughts on that?
Yeah, I think local identity is really critical. It creates nice places. I don't think that necessarily having access to shops and services, public open space, health services, public transport, I don't think that will actually, that's not going to take away local identity. It could be delivered in a different way, but the idea is that people have access to all the things they need for a good life that will make it, you know, create health and well-being. So I think my sense is that it's not going to be a cookie cutter approach. It can have local identity, and in the way it's delivered could differ, you know, very much across the city. Just the idea is that the basic amenities need to be accessible, and we're going to try and, when we create our livability index, we want to then look at what happens if you live in an area that's not very livable. What is the health impact of that? What do we see in terms of the health and well-being of local residents? So that's where we're going with this work, but I don't think that the delivery of it needs to be a one-size-fits-all, because even culturally, the way those spaces might be created could be somewhat different across the city.
Great, thank you.
Okay, thank you very much. Thank you.